Hello, everyone. Welcome to Entourage Effects. Today, we're going to be talking about my experience with irritable bowel syndrome and small intestinal bacterial overgrowth. Irritable bowel syndrome is a disorder where you either have constipation or diarrhea or a mix of both. And along with this, you have other issues such as acid reflux, and so the food just doesn't clear from your stomach into your small intestine very well, so that ends up sitting there for a long time, and you get very backed up. I think at a certain point, it felt like I was carrying around 6 to 8 bowling balls worth of undigested fecal matter in my stomach, which was quite painful. It is a very, very hopeless disease when you're in the nitty gritty of it, when you're really suffering, because the medical industry doesn't really have an answer. Irritable bowel syndrome is kind of just like a trash can diagnosis, is what they call it, because they don't really know the reason. They don't really know why it's happening, and they just throw things at you to try to make you feel better. Oftentimes they end up making you feel worse, and just that uncertainty of not knowing what is going on with you, why is it happening, that creates just a level of hopelessness and despair that I think a lot of people struggle with, because this is actually, irritable bowel syndrome is a disorder that 15% of the population it has issues with, and a lot of this can be tied to anxiety and just mental unwellness, but that is almost used as a gaslighting technique by the medical industry. They will tell you it is just, all your issues are just anxiety. There's nothing really wrong with you. But that's because they themselves do not understand what is wrong with you. So with irritable bowel syndrome, the real issue is actually a motility issue, which the peristalsis of the intestines, which is like a little movement of propulsion that allows your food to move along. There's actually it's the MMC, or the migrating motor complex, is what kind of clears your intestine and keeps things clear from bacteria. But this issue, when the motility is disrupted and the things fail to move from your small intestine to your large intestine, the bacteria actually start to move up from your large intestine into your small intestine, where they're not supposed to be. Those bacteria are helpful in terms of breaking down the types of foods that you are not able to, or that you don't need, or like things in the food that you don't need, but they're not really supposed to be in your small intestine, because that is where the majority of your nutrients are absorbed, and that is where the majority of intake of what you need from food. That's the first point of entry. But when the bacteria start to move up, they start to disrupt that motility, and things don't clear out from your stomach as well. You end up being very backed up, and then you have those symptoms of constipation or diarrhea, or a mix of both, along with reflux, bloating, pain, and it's just a vicious cycle. And because you don't really know what's wrong or what's happening, you try things like the laxatives, or the things that most people would think would help cure constipation, right? Because that's what I had, IBS C, it's coined, right? So you think you're constipated, you think you're backed up, you think you're constipated, but it's actually not even constipation, because this is going to get, a little bit maybe graphic, but in terms of it's not dry stool. Constipation specifically is dry stool that is not moving along very well. But in my case, the quality of the stool was fine, but the actual issue was the movement of the fecal matter throughout your intestine. So, but instead of tackling the motility or movement at first, you don't even know that's the issue, right? You just think you're constipated. So you end up taking laxatives, or you end up taking, like, I think, I forgot the name, but there was this, it's like this, it helps you clear yourself out, but it's actually something they give patients to test for SIBO. I can't remember the name right now, but it's like another type of sugar. I think it's similar to glucose but I think the structure of the sugar is different. It's one of those, but it actually feeds those bad bacteria, and it's what you drink when you go in for like a SIBO breath test. But it also helps with diarrhea. But that's something that my aunt, who's a doctor, she prescribed me, but she didn't know what was going on with me. But even though it cleared you out, it ended up just feeding the bacteria in your small intestine, which ultimately was not what you wanted. So my issues started probably, I think in high school, they definitely got worse. But before that, I think they were always there to some degree. But over time, they definitely developed and got worse. So by the time I was in high school and college, I was lugging around those 6 to 8 bowling balls in my stomach, having like so much gas, but I wouldn't be able to pass it. I would just be like burping it out, and I would just be in constant pain. And so for many years, I lived life like that. And, I didn't want to live, to be honest. It was quite a miserable existence. I didn't know why, God gave me this ailment. I didn't know why me, a lot of people ask, but so I first, well, actually after probably many years of struggling with it, I eventually ended up going to a gastroenterologist, Dr. Leonardo Mendez, and he is a pretty good, gastroenterologist, but the issues with the medical industry are more widespread than any single doctor. It's more so the way that they're taught and the way that just medicine is practiced as a whole. Like you treat the symptom, not the underlying cause, which is the way that a lot of osteopathic medicine, or honestly even the allopathic doctors, practice it that way now. It's just kind of the training that's different, but they don't really take that holistic approach which is necessary for, health and well-being. They're just trying to figure out what the symptom, you have atrial fibrillation, you go get, surgery to fix that. You have, like anxiety, you take a pill to get rid of it. You have, like, there's just, you're trying to treat the symptom and not the cause. So when I went to see Dr. Mendez, I ended up having an endoscopy and a colonoscopy. And so they didn't really find much in terms of like pathology for why I was struggling the way I was and the reasons for me being so sick. They did find an ulcer in my stomach and a lot of esophageal inflammation. And that esophageal inflammation is actually a risk factor for even cancer if it is exposed to that too long. And so the reason for that esophageal inflammation, which is that area, like your solar plexus and a little above that area, like where you would commonly experience reflux. So there's a sphincter, like a little thing that closes at the top of your stomach called the lower esophageal sphincter. And when that motility stops working and when things stop moving along as well and food is sitting in your stomach for very long, and actually another contributing factor to that as well is low stomach acid. So, because the stomach acid is not able to break down the food in time to move it along. And that sphincter that normally closes things stops working as well, and it opens and it starts letting food and acid flow up into your esophagus, and that causes inflammation. And along with that, I had the ulcer, and I was very backed up in addition to that, gas, bloating, all of that, reflux. So initially they put me on PPI, which was meant to reduce the amount of stomach acid, to help. And I would say it did help in the beginning because it did help my ulcer to heal. But the issue with the way they prescribe it is that they will just keep you on it. They will keep you on it forever, and then your stomach acid goes down even more, and things just don't digest because you're not able to break down the food because you don't have enough acid to break down the food. In addition to that, they put me on a few different medications for constipation, which again, not the thing that I'm even trying to treat, but I didn't know that yet. I tried Linzess. I tried, I can't remember the names of all of them, but they all, Trulance and Linzess. Those were the two I tried first. And Linzess was really miserable. It filled my stomach up with water, but nothing would move. Again, I had a motility issue, right? It wasn't actually the water content in the intestines. Trulance helped a little bit more. Again, it would fill me up with water, but then I would be like a waterfall down there for a couple hours. And it did help a bit, but it was still uncomfortable. I was still backed up. I still had the issues with my, kind of the stomach and sphincter and my esophagus, like things still not clearing out, still not moving along. So I went back to the drawing board. I kept kind of trying to research what could be wrong with me, and I stumbled upon, the microbiome, and kind of more so focusing on like holistically what's going on in your gut, right? And so I went back to the Dr. Mendez, and I talked a little bit about SIBO, and maybe that was the reason why I was suffering the way I was. So then he put me on the antibiotic rifaximin, which is kind of the go-to antibiotic. We actually didn't even test if I had SIBO. We just kind of threw some antibiotics in there, see if it would make me feel any better. So when I was kind of convinced I had SIBO and I talked to him about it, we started the course of rifaximin, and then a little bit later into the course, maybe it was when I was fully done, we started a prokinetic called Motegrity, and that is meant to target your motility. And that had kind of a tremendous effect at first. That Motegrity, which kind of finally got the motility in my intestines moving, that was when I first felt kind of relief and realized, yes, it is a motility issue, and it is just the peristalsis and things moving along, which is causing my issues. But then eventually the effect waned, and I would say within 2 weeks, Motegrity stopped working. And my body has always been special in that I'm able to kind of maintain homeostasis even in my shitty state. So a lot of the things I try end up even if they have some benefit, they stop working a week, 2 weeks, a month, something like that, which, really sucks, but it is what it is. It's just your body trying to maintain what it thinks is normal. So I went through that course of rifaximin and Motegrity, and then I was just feeling how I was normally. And I had already tried, and I was already on low FODMAP, uh, which is the low or less fermentable diet. You cut out gluten, garlic, onion, and like a few other things. It's more than a few, but yeah. So I had already kind of been focusing on my diet as well, and my diet was very clean at that point, mostly organic, fruits, veggies, some meat. Even that's mostly what I eat now, some dairy products. But no matter how clean my diet became, my issues never really improved at all. So after that, I kind of stopped even taking the Motegrity, and I just continued researching more and more about SIBO and how to fix SIBO. And a lot of people take the approach of trying to just nuke your intestines with like a lot of different antibiotics, just natural antibiotics. So I went that route just by myself for a while, just doing research on what I could do to kill this bacteria in my small intestines, right? I thought that would maybe fix my issues. And I went through that whole process. I was taking 10, 15 different things, trying to fix my gut, trying to kill that bacteria in my small intestines. And I didn't really have much improvement. And I went through that for a few months. And then eventually I decided to hire a nutritionist. And so we went through, kind of talking about what my different issues were and my diet and what supplements I could take. And she took a similar approach to what I had already been doing. She tried to improve my motility a little using a few things, but they did not really help. I was just as miserable when I was seeing the nutritionist. She had me on Candibactin AR and BR, and they upset my stomach so much. They were like a very harsh antibiotic you would take, and it wouldn't pass from my stomach, and I would just be constantly getting the gas and the bloating, and it would just be flowing up into my esophagus and causing that inflammation. And no matter how long I was on it, despite being on that and then like some herbal things for my motility, no improvement. Nothing. Like I was just as miserable on it despite paying, thousands of dollars for supplements for the nutritionist. They charge crazy fees too. They have to make their money somehow, whether or not you're getting better. And she tried her best, I suppose. I don't think she had ill intent, but she did what she knew, right? She did what she was taught in school. She did what she believed was right, but it didn't really help me. And after many months of that, I ended up kind of discontinuing that as well. And so eventually what I found that had any really positive benefit or any real effect that was more long-standing was thiamine. Thiamine is a B vitamin, and it is deficient in many people with SIBO and irritable bowel syndrome, and it also, like a lot of people with those issues of motility or low stomach acid or that esophageal sphincter not closing properly, or just a general motility and health of your intestine. This vitamin, when it's deficient, it causes and mirrors a lot of the same symptoms. In fact, it's very strange to have a thiamine deficiency because it can show up in a host of different symptoms and issues, including like brain fog, neurological symptoms, and other, physical manifestations outside of just gut disorders. And supplementing thiamine has also been found to benefit in people with Alzheimer's, Parkinson's, multiple sclerosis, so a lot of the neurological things as well. But in addition to that, a lot of the gut issues, obviously. So the types of thiamine that I tried that helped were, or I guess the ones I tried at first were benfotiamine and TTFD. So benfotiamine, again, was a little rough on my stomach. It didn't really help all that much. TTFD, actually, when I took TTFD, the first 2 days, it was life-changing. It was almost like the issues I had completely disappeared overnight. The first 2 days I took it, and I took 100 milligrams, which was a bit high, I suppose, to be starting out. But the motility had started working completely normally, and I wasn't having that lower esophageal sphincter opening up anymore, and my stomach acid kind of had normalized for 2 days. But then after those 2 days, things got much worse, or things got very, very bad. And so I continued to do more research on but I had more hope, because I figured, I've never had something that had such a big effect on my gut motility or my issues. So I figured, it probably is somehow related to this. So then I continued to research more, and I found out that there are some cofactors that thiamine may make you deficient in. And in addition to that, there's something called the paradoxical reaction. And that is where your symptoms will get worse before they get better. And I would say I definitely experienced that. And so I decreased the dose from 100 milligrams to 25 milligrams. And when I did, again, positive benefits showed up, right? Okay, the dose was too high. Maybe my issues are solved now. Nope. Another day or two goes by with having, better bowel movements and better overall gut issues. I would say I even had some mental improvements in terms of, I thought I had ADHD, or maybe I do to some degree, but a lot of it was just, one, I think this world creates an environment of being depleted in dopamine, whether it's scrolling on TikTok or eating junky food or whatever. And I think when you have that low dopamine, you kind of create a state of ADHD for yourself. But then also my gut issues, my gut disorder, all the anxiety I was experiencing, and it was creating brain fog. I think maybe I was deficient in some nutrients as well, because my gut wasn't absorbing things properly. And that also created some mental issues, mental blockades. I was still able to function well in school and still able to do what I needed to do to a degree, I suppose. But it still created, a lot of issues. But I saw some improvements in that as well, which were very positive. So then eventually, I started researching more of the cofactors, and I found out, you can be deficient in magnesium and potassium, and then you can use N-acetylcysteine or liposomal glutathione to replete your glutathione stores, and you need to take other B vitamins as well, like pantothenic acid, niacin. I think that's B1 and B6. And there's a few other things that you can take as well along with it, like Bacopa monnieri, and just other things to help support it. Because when you take the TTFD is a better absorbed variant of thiamine, and you take it at very high dosages. So it can make you deficient in a few other things as well. So it's important to cover your bases when supplementing with thiamine, whether that's benfotiamine, TTFD, phosphatidyltiamine, allithiamine, whatever it is. There's a few different forms of thiamine, and different people respond to different versions, or even TTFD, for example, some I have seen online where one gentleman, he was able to just take 25 milligrams. He never had to go above that. Some people have to go all the way up to 1,500 milligrams a day. And the majority of TTFD supplements available are found in 100 milligrams. So I had to start by dumping out 3/4 of the capsule, starting at 25. And then I slowly moved my way all the way up to 1,000 milligrams a day. And that's where I am at right now. And I would say right now, my symptoms in terms of the like my the clearing in my stomach are much better, and the lower esophageal sphincter has started to close, and kind of I can feel the motility in my small intestines. And this used to be like this area used to be like a dead zone for me before. I didn't used to feel anything here. Now I do feel things moving. I would say the effect I have of clearing my entire bowels and just kind of being fully clear, that isn't perfect yet, but I am still hopeful because things are still moving in the right direction. But the biggest change I have seen would be in terms of just my small bowel, and just the decrease in terms of like acid reflux and just, esophageal irritation, and just clearing out from my stomach, like 2 or 3 hours after I eat, I can almost feel like my stomach is empty, and it feels like, that feeling when you get like hunger pangs. Like I'll get that like 2 or 3 hours after I eat, which was unheard of before, because I would eat something in the morning and it would be coming up all day, and then I would be like eating dinner or some shit, and I would still like taste what I ate for breakfast this morning, because it hadn't moved along yet, so I think taking that TTFD was kind of monumental in terms of just increasing my small bowel motility, and just helping me with just a lot of the pain and the gas and the bloating and the lower esophageal or the esophageal irritation I was having, and that lower esophageal sphincter opening. But I would say I still have some ways to go in terms of just like maybe it's my large bowel motility, or maybe it's just, I guess, like the full bowel motility in terms of just clearing out. I still have a little bit of a ways to go in terms of that. I'm still not entirely sure why it's not, because it's strange, right? Because like the first 2 days things were perfect, and then dosage was too high, you bump it down, things were perfect again for like 2 days, and then they stop again, and you start to take cofactors, you feel a little better, but then like the improvements stay in some areas, but then other areas don't show as much improvement. So I'm hoping that this content and this video perhaps will enlighten some of you with irritable bowel syndrome and SIBO that you might be suffering from a thiamine deficiency. And actually, the interesting thing about thiamine is that even if you're not deficient, you can still have improvements in gut motility by, I think it's specific to TTFD, but TTFD has shown to increase gut motility even in people without the deficiency. So in terms of that, it is very important and versatile in terms of whether or not you're deficient. You may be deficient. It may be showing up as some, weird hormonal things, weird, I don't know, brain, like neurological symptoms, weird gut issues, weird, I don't know, random pain. I mean, it could be so many weird things that happen because of having a deficiency in this. But then also, even if you're not deficient, you can still see improvement by supplementing with TTFD. And actually, one of the things that causes a depletion in thiamine or TTFD is eating a high carb diet. And Americans, you know how we are with our carbs, man. It's a little too much, to be honest. All the gluten, the wheat, the donuts, the sugar. It's insane, honestly, how we consume in this country. And I guess perhaps I'll post like the supplements I'm taking now, or like a supplement list that you guys could look at and maybe think about supplementing with, trying out. Um, but I think the most important thing, well, anxiety can also actually be a big factor, because anxiety puts you in that fight or flight state. And so there's two states that you can kind of exist in, which is fight or flight, or rest or digest. I'm sure you've heard of that before. So when you're in that anxiety driven state and you're stuck in that fight or flight, the rest and digest portion of your parasympathetic system is not functioning as how it's supposed to. So you are in that state of like, oh, I there's a threat that I need to deal with. So I'm going to be putting energy to those different areas, whether that's your brain or your body, to be able to run away or fight or whatever it is. But you're like those other body processes that happen when you're kind of less anxious and restful, allowing you to digest your food, that is not functioning properly. So anxiety is also actually a very big part of it, and it can be a contributing factor. But the way that the medical professionals gaslight you into thinking that anxiety is the only reason for your irritable bowel syndrome or your gut issues is quite honestly just bullshit. Like if you walk into a doctor's office and they tell you that, my advice would be to just walk out. Because they're not going to help you, man. They're just going to make you feel shitty or gaslight you into thinking that it's all in your head, which is just not true. But they themselves do not understand the issues with motility or why this is happening, and they themselves don't have the tools to help your issues. You know, they are, you know, very experienced and very good at treating other gut issues or other gastrointestinal issues perhaps, but specifically with irritable bowel syndrome and small intestinal bacterial overgrowth and just motility issues, they just do not know how to help. So I guess my recommendation or prescription for you guys in terms of what could help you with irritable bowel syndrome or even other neurological symptoms like brain fog, Alzheimer's, Parkinson's, multiple sclerosis. I mean, thiamine has helped a lot of people in those areas as well. But I guess mainly for gut motility and gut issues would be supplementing with some type of thiamine, whether that's thiamine HCl, you're going to need higher dosages of that, or benfotiamine and TTFD, which are more bioavailable, they're absorbed better. And so you would start at a very low dosage of TTFD, slowly move your way up, make sure you cover your bases with all the cofactors that you need so that you're not deficient in anything. And you may start to see improvements in your motility, your clearing from your stomach, you know, just your small intestine moving, and like if you're experiencing issues with reflux and like esophageal irritation, it would also help in those areas as well. So in terms of that, that's a good area to focus on, you know, supplementing with something you may be deficient in or something that can improve your motility. This is the only thing I've really found that has improved my motility over any basis that is long enough to be, you know, useful. Like everything else, the effect would just wear off, and it would stop working after a week or two. Even though this one kind of like it didn't work perfectly, but I still have a lot of benefits, and like a lot of my symptoms are gone now because of supplementing with it. And along with that, actually, supplementing with betaine HCl and digestive enzymes. I think it's made by Pure Encapsulations. That's what I've been using. That helped a lot too with my reflux, and I think I was struggling with low stomach acid as well, and that was part of the reason why I was getting the reflux and things weren't clearing as well. So the supplementing, you know, different things is definitely an important avenue to focus on. And nuking your gut with you know antibiotics is not really helpful. You don't want to kill you don't want to kill what's going on in your intestine. There's a deeper root cause or root issue or multiple things contributing that are manifesting in symptoms that you are suffering from. So that part is important. But then the other two parts that are very important is your diet, right? You need to make sure you have very clean diet, organic if you can. I would say mostly fruits and veggies and, protein from meat and dairy sources. Eggs are always good. If you stick to mostly that, I think you're sticking to a more primal way of eating. You're sticking to the way our ancestors used to eat. And it's just a healthier way of living, really. And you'll start to feel better mentally, emotionally, physically once you start to clean up your diet. Because food is really medicine. And once we start to realize that and incorporate that into our lives, you will start to see benefits in a lot of areas. So, again, supplements and diet, and actually, this is something that even the nutritionists and the people in the medical field didn't really talk about. But dietary oxalates are actually kind of a scary thing, and removing oxalates or decreasing oxalates in my diet is something that kind of helped me too. So oxalate is this kind of like crystal thing that plants have that helps. I'm not really sure the function. Maybe it's to protect them, but it builds up in your system these little crystals, and eventually you get kidney stones and different things from it. But you could even issues like gut disorders. It doesn't absorb as well. It's like little pieces of crystals, and they can build up. And it's just, and then when you stop eating oxalates, which this is something I experienced oxalate shedding. So my random weird symptoms got worse over when I tried cutting it out. And so I went back to researching a little more, and I found out you have to decrease it slowly. And things like chocolate, nuts, seeds, and then some fruits and veggies have those oxalates. And I think kind of trying to remove those dietary oxalates from my diet is also something that helped me. And then I would say the third aspect of what you need to focus on if you're trying to get better in terms of these gut issues is your anxiety and your mental health and well-being. And I would say this is complicated because a lot of it is tied to your gut issues or to what you're experiencing, right? A lot of anxiety comes from experiencing such terrible symptoms, being in a state of despair, not knowing what's going wrong with you, and just feeling hopeless, feeling suicidal, whatever it is. So again, if you focus on those other two aspects, which is your diet and the supplements, in terms of focusing on something you might be deficient in or trying to target that motility to improve it. It doesn't even have to be TTFD. It could be other things like ginger artichoke extract. I saw one gentleman online. He was able to fix his SIBO just by taking ginger and artichoke. It didn't have such a dramatic effect on me, but I would say it did help to some degree, but it didn't have, a life-changing effect on me. But some people responded, again, all our bodies are different. The neurophysiological and just biochemical compositions of our bodies are totally different, right? The way we just respond to different things, even if we have the same issues, right? Even if we both have IBS, the way we respond to different medications, different supplements, different foods, it's still going to be different, right? So you don't know for sure what helps you is going to help someone else, right? But I guess all I'm trying to do here is share my experience and what helped me, and maybe this will help some other people, and or at least point them in the right direction in terms of, okay, this is a motility issue. This is a motility disorder. It has nothing to do with constipation or just like dry stool or anything like that, you know? It's actually the clearing from the intestine. You know? So clean up your diet, right? Eat as healthy as you can. Try to get a lot of fiber in terms of fruits and veggies, and then get clean sources of protein, right? So that'll help target in terms of, okay, am I getting the nutrients I need from food? Am I eating the right things? Okay. And then you supplement with your whatever you need to increase your motility, or, you know, trying to target those issues that you have. And then the third area, once you've done those two, then you start to focus on your anxiety and your mental health and well-being. And I think once you start to clean up your diet and you start to supplement and you start to see some improvements, your anxiety and your mental health and well-being will naturally improve to some degree. But of course, there's always more work we can do, right? There's vagus nerve exercises that help your motility. There's breathing exercises that help your motility. And there's, you know, meditation, things like that. Some people need psychiatric medications to help with anxiety. Those can help sometimes as well. But I think reducing that fight or flight state and trying to allow yourself to rest and digest, along with food and supplements. I think if you can focus on those three areas, you will see dramatic improvements in your life if you suffer from irritable bowel syndrome or small intestinal bacterial overgrowth. And I know that this is not, I mean, if you're somewhat experienced about small intestinal bacterial overgrowth or, you know, IBS, you may be thinking that this is not correct. You have to go on antibiotics. You have to kill the bug. But that's just not true. It's just not true, because it's not, the small intestinal bacterial overgrowth is the symptom. It's not the cause. You feel me? It's not the cause. It's the symptom of things not moving along. So you have to treat the cause. And once you treat the cause, the symptom itself will alleviate naturally. And I think taking that approach is the right way to go for this issue. Yeah. And I think that's a lot of the issues around the medical field, and even nutritionists, surprisingly, which they treat the symptom, not the cause. And we have to start treating the cause, and that's not just in terms of gut issues. That is in terms of all the diseases that we suffer from, like AFib, right? Instead of going in for a surgery, clean up your diet, lose a little weight. It will go away naturally, you know? Like, personally, in terms of depression and anxiety. I'm not saying this is the truth for everyone, but I would say personally, a lot of the times, depression and anxiety comes up. One, you're dealing with shit, obviously. Everybody's dealing with shit, but, you know, shit. Get it? IBS. Anyway. Shit, in that regard, like IBS, or maybe your life isn't just going how you want it to. Maybe there's things in your life that are coming up that your mind is telling you need to change, but perhaps you don't have the confidence or the grit to yet go through with it. But personally, I would say focusing on those things, trying to figure out why I'm feeling this way, trying to do things in my life to improve it, ultimately ends up improving not only those symptoms of anxiety and depression, but benefits your life in other ways as well. So if you made it to this point at the video, please like and subscribe. That would mean the world to me. I'm just starting out this YouTube channel, and I hope to educate you guys in other areas as well, and there's a lot coming. So please keep your eye out. And I really appreciate anybody watching. If you could, like, share, or subscribe, that would mean the world to me. Yeah. So thank you so much, and I'll see you very soon.